Well, hi everyone, and welcome to Health Chats Among Friends. My name is Deidra Kindred. I'm a nurse advocate, educator, and navigator. And tonight, during our special Health Chats Among Friends, I have a special person to come and talk with us. So, my friend Mary Denaro is the owner and operator and CEO and lead for Pondhawk
Pondhawk.
Advocacy. Good, I got it right. So, Mary, you take it from here. You tell the audience a little bit about yourself, and then we'll go into our
Okay.
topic.
Well, thank you so much for having me, Deidre. I'm really excited to shed some light on a really murky realm of the healthcare system. Um, as you mentioned, my name is Mary Denaro. I'm a board certified patient advocate, a breast cancer survivor, and the founder of Pondhawk Advocacy. I use my medical billing experience to ease the burden of medical debts. I believe that patients should focus on healing rather than stressing out about medical bills and health insurance denials. I act as a liaison between the patient, provider, and health insurer to work to correct errors, dispute coverage denials, and negotiate discounts.
Wow, this is huge. I really think it's huge because not only am I super excited to talk with a fellow advocate, I want people to know that we all have our own specialties, and one advocate does not fit all, right?
Right,
And so there's
right.
different avenues in healthcare. And so tonight, our topic is from patient to dollar sign.
Yes. It's
So,
a really just as the healthcare system is complex and confusing, the medical billing side is no different.
mm-mm.
And today I think I'm going to focus mainly on the hospital billing, mostly because that tends to be the most confusing. It's where my clients usually come to me and say, I've got bills from doctors I've never seen before. I'm being duplicate billed. I don't know what's going on. And so I'd like to shed some light on what happens when you have a hospital encounter, and maybe provide some tips on how you can navigate or deal with the billing entities in a more effective manner than you might already be doing so.
Wow, wow. So since we can't have all visual, I suggest grab a pen and paper because this is going to be good. Okay, so let's
Okay.
start.
Okay. So, well, I'm just going to use an example. Let's say you had a broken leg, so you go to the emergency room. You have an assessment by an emergency room doctor. He sends you over for an x-ray to confirm that the leg is broken. They do confirm that. They put you in a cast. They discharge you and send you home with some paperwork to tell you to follow up with an orthopedic doctor.
Hmm.
Um, a couple of weeks go by, and then all of a sudden you receive a bill from the hospital. Then you receive a bill from an emergency room doctor, and then you receive a bill from a radiologist.
Right.
Um, so, what happens in these instances is in any medical encounter, any medical visit that you have, we all have, there's a medical record that's associated with that. So as the process goes along and you're getting different services, they're marking your medical record, they're adding diagnosis codes. Once that's all said and done, there's a coder on the other side who's either certified or not certified, look at the medical records and interpret those records and turn them into a 5-digit code, which is called a CPT code.
Hmm.
And they will also assign an ICD-10 diagnosis code. And that either gets sent over to your insurance company or directly to you if you don't have insurance. Um, what also happens is the hospital bills for their services for the facility charge. The ER physician bills separately for his charge, and the radiologist also bills separately for his charge. So the physicians, in most cases, there are some hospitals that physicians are employees of the hospital, but in most cases, ancillary physicians are independent contractors and are responsible for their own coding and billing And a lot of these hospitals and physicians use third-party companies to bill out your these codes to the insurance company and then generate an invoice to you, the patient. Then what happens is you get the bill, you pick up the phone, you try, to get some help as to what's going on, and the other person on the other line is not very helpful.
No.
So why is that?
Sometimes they're very rude and unpassionate and ununderstanding. They just.
Well, I'll explain exactly why that happens, Deidra. So you're dealing with an employee who may or may not care about their job, may or may not care about going above and beyond. They're typically in a call center environment. So as soon as one call hangs up, they're getting another phone call. So it's a very fast-paced environment. On top of that, this person who's on the other line is not well versed in medical coding or health insurance. So that's why they tend to not be super helpful, because they're not really they don't have a full understanding of how the process works. So they're a customer service representative. Their job is to collect money. So if they feel as though this person may not be, they're not going to pay this bill, I'm going to try and get them off the phone as quick as possible. So what I would say so that's how you go from walking into the emergency room, then you turn into a medical bill. Right. And if you bring those medical bills to your physician, they're going to look at you with glossy eyes and say, call the billing department. I can't help you, because they're so separated from it. And, they've got enough going on that, that's the reason that's kind of outsourced, because, does an emergency room physician have time to do the work that they do and then do the administrative side? No. So it does make sense to outsource it, but it is really helpful for you as the patient to be prepared, just like you would be prepared for your doctor's appointment before you call the billing department. Have all of the information that you need ahead of time. Don't depend on that other person to have the information that you need. And what I would say is, never pay the first medical bill. Make sure that as soon as you get that medical bill, you ask for an itemized statement. So it's part of your patient bill of rights that a hospital provider must send you an itemized statement upon request. So once you do that, you can compare. I would also recommend getting a copy of your medical records, just to make sure there are no errors in your medical records. If there's an error in your medical records, there's an error on your bill, right? So
now, is there a fee for your medical records?
Sometimes hospitals will charge you, but a lot of times now you can receive them electronically, and I don't believe that they're allowed to charge for electronic medical records.
Oh, good. Okay.
I'd have to double check on that, but I'm pretty sure they're not allowed to. And then also there's patient portals now. So patient portals, you may be able to access some, maybe not all of it, but you can see, what the diagnosis was and what they said that they did at that visit. So you can also use that to compare to make sure that there's no errors.
Good deal.
I would also recommend to check with your insurance company to make sure that if you have insurance, that they have the claim on file, that it's been processed. Make sure there's no denials on the claim, and ask them, what is my responsibility? And they should be able to tell you how much your deductible would have been, how much your co-insurance or your copay would be. And you should compare that to your medical bill to make sure that they are the same. And
so I got a quick question I want to add. So sometimes people get what they call what is an EOB, estimate of billing?
Explanation of benefits, yes.
Okay, so would that be a good thing to, look at? Because, the bill is coming. So they've estimated. So would that be a good time to call your insurance company?
You can also
Or,
use your explanation of benefits in lieu of calling your health insurance company. So some insurance companies will mail them directly to you. Some of them will upload them on the portal. And again, I would highly recommend having access or registering for your patient portal. Gives you real-time information on deductible and out-of-pocket accumulations, your claims summary, so you can look over claims to make sure there's nothing, I've seen claims get submitted for services that never happened on dates of service that never happened. Things happen, so you can take a look at that. You can also check your network status online through the patient portal before you go to the doctor or hospital. And that's all real-time information via the portal. Saves you time from calling the insurance company, sitting on hold, and maybe having an unhelpful representative on the other line.
right. So, Mary, that brings up another point too that I was going to ask you about. So, say Miss Jones is scheduled for a surgery. She goes in, she meets her surgical team. They have everybody come in and meet you. Should she ask then who's in network? I mean, because some of the anesthesiologists are out of network, not a hospital or surgical center employee. So, when would be a good time to ask?
Okay. Well, I'm glad you brought that up. Never, as a patient, it is your responsibility to check network status. Never go by what your doctor or the hospital tells you. I will tell you that, say you have Blue Cross and Blue Shield, and you pick up the phone and you call the hospital and say, do you take Blue Cross and Blue Shield? They're going to tell you yes, but Blue Cross and Blue Shield has thousands of different policies. So unless you're specific about the type of policy that you have, then they can't really give you accurate information. And a lot of times, even the hospital, they have so many different contracts, that it's hard for them to keep up with. So what I would say is, to Miss Jones, if you're going to have an elective surgery, or if you're going to see a physician for the first time, or even if you haven't seen that physician that you have established care with that year, check the network status with your insurance directly. So you can either do that, as we discussed, through the patient portal, look up to see if the hospital or the surgeon that you are going to see is in network. The other option is you can talk to the provider, whichever various provider that is. You can ask for the billing NPI number, National Provider Identifier Number. This number is required on all claims, and that is where you will get the most accurate information from your insurance company. So you can call them and say, I have this NPI, this is the physician's name, are they in network? And then when you get the information from the insurance company, I highly recommend asking for a reference number to go along with that call. That way, if for any reason your claim is processed out of network, you have that phone call as backup. And to add on to what you mentioned about the anesthesiologist and the ancillary physicians, sometimes, or in most cases, these physicians are out of network. And so there are some states that have comprehensive protections against what's called surprise billing. So this would be a surprise bill. You go to an in-network hospital, you do your due diligence, you check to make sure everybody's in network, but then you get a bill from the anesthesiologist that's out of network. In some states, you are protected. They have to accept what the in-network rate would be. They should apply it towards your in-network benefits. And the out-of-network provider shouldn't balance bill you. The difference between what the insurance company allowed and what the provider charged. Now, the big thing about that is in January 1st of 2022, the No Surprises Act will take effect. And what will happen in that case is there will be an independent dispute resolution process, which will take the patient out of the negotiations between provider and health insurer. And it will protect a lot of people globally, or a lot of people, even those with self-funded plans, from these surprise bills.
Okay, we're definitely going to have you back to talk about that. Super
Great.
excited.
Yeah, there's
Super
a lot
excited.
of great changes in that
Yes,
No Surprises
awesome.
Act.
Okay. All right. So let's get back to your tips for this medical billing process.
Okay. All right. And so what I would say is, if for any reason you find there is something wrong with your bill, as I mentioned before, gather all the information that you need. Get your insurance card, get your medical bill, get the itemized invoice, the EOB, and kind of map out your phone call. Write out what you think the problem might be, and what solutions you think there might be to fix that. And if you're unable to come up with this on your own, that's a good time to reach out to a patient advocate for help.
Right.
And what I would say is, you call the provider's office and you tell them, here's what I think is wrong. Here's why I think it's wrong. And let me send some support if they're argumentative with you. And I'll give you an example. Okay. I had a client, had a fast moving lymphoma cancer, and he was in and out of the hospital for many days. And he came to me with a mountain of paperwork, bills, EOBs, and as I'm sifting through it, he had a bill for $1,500. At this point in the year, he had already met his deductible, his out of pocket, and the hospital was in network. So really, he shouldn't have a balance.
Mm-hmm.
When he tried to get in contact with the billing department, they told him, it's your deductible. So he said, he didn't have the energy or the time to really deal with it. So I took over. And when I looked at the explanation of benefits, he was in the hospital for 5 days. The hospital neglected to get authorization for the last 2 days. And when I got in contact with the authorizations department with the insurance company, I was told the hospital had 7 days from the day that I was calling to give them an update, and they would retroactive the authorization for those last 2 days. And then I can get the claim reprocessed and those last 2 days paid. Well, when I called the billing department, the first person I spoke with said, nope, it's deductible. It says right here on my system that it's a deductible. And I said, okay, well, let me send you the explanation of benefits that shows that it was denied, not authorized. Let me also send you the name and reference number from my phone call and the phone number that I called to the authorizations department.
Mm-hmm.
And within 48 hours, they had the claim or the authorization approved, and the claim, not only did that claim get reprocessed, but there was a radiologist claim that also simultaneously got reprocessed due to the fact that there was no authorization on file. So, sometimes
my excitement. I'm just so excited about that. That's awesome.
And I just want to add something a little bit about what we were talking about Miss Jones as she's preparing for her elective surgery. She can also ask her insurance company if a prior authorization would be required for her surgery or whatever treatment or procedure. And in that case, you can ask the doctor's office for the CPT code and the related diagnosis code to verify the authorization status with the insurance company.
Awesome. Miss Jones is made up. It was just a story. But that's great information. Wow. Okay, let's keep going.
Mm-hmm.
Okay, so I'm to.
And so,
go ahead. Go ahead.
Okay. And so, if for any reason you get pushback and you know that the person on the other line is not giving you the correct information, escalate it to a supervisor. Ask for a supervisor for help. Sometimes the other person, as I mentioned, on the other side may be new. They may not have a care in the world about what's going on, or they may not even know how to operate the software to dig in even further. So sometimes escalating to supervisor can help dig deeper into the problem and find a resolution.
Wonderful. Wonderful. Well, to sum up some of the things that we talked about, because we can't give it all to you, right?
Yeah.
This is good.
Right.
And what I'm taking from this, because I was taking notes, and what I'm taking from this is that when you have a medical issue or whatever it may be, it's already stressful. It is already overwhelming. It is already time consuming. All those things increase your stress. So to me, that is the main benefit to incorporate a patient advocate who specializes in medical billing to help you out with this, because the last thing you want to be on the phone is arguing with someone and you really don't know to get your ammunition ready or what's the right questions to ask, or who you need to ask for. I value your service. It's wonderful. It's very informative, and I think people can't do without it, especially when it comes to this sort of stressor.
Absolutely. Thank you,
Yeah,
Deidra.
so you are
Yes.
very welcome, and I'm so serious. Just to kind of sum up, so let's talk about a little summarization.
Mm-hmm.
So I wrote down, don't pay the first bill.
Yeah. Yeah.
Don't pay the first bill. Ask for the itemized statement. And should that be
Mm-hmm.
something that they do all the time?
Yes,
Maybe.
yes, because usually the first bill may have an itemized on, but they might be lumped into certain
Okay.
categories, especially in a hospital bill. So when you ask for an itemized statement, that's going to give you a detailed line by line listing of everything. Sometimes there's just one line item, but you want to also, those itemized statements will show you any adjustments that they might have made on the claim, any payments that they received either from the patient or the insurance company. So it's a transaction history, which is on the itemized statement, should show you exactly what's gone on
Awesome.
that bill.
Awesome. And then I also wrote down, check with your insurance company about what you're responsible for.
Right, right.
Okay. And look at that EOB. Always look at that. And do you compare that to your itemized statement, or is that just an estimate of benefits, or will it be the itemized statement's the
Um,
better one to?
An EOB is an explanation of benefits. So
Okay.
it's really a receipt or a statement from your insurance company showing you exactly how they processed the charges from your provider. So yes, I highly recommend matching that up to your medical bill, the EOB with your medical bill and itemized statement, and check to see if the balances match. If they don't, then there could be a problem. Maybe your insurance company denied something. Maybe something's listed as a non-covered charge, or maybe the hospital applied your benefits or payment incorrectly. So there's a lot of, or maybe they didn't bill your insurance at all. Sometimes there's administrative errors. They sent it to the wrong insurance. The ID number is wrong, or in an emergency situation, sometimes you miss the part where you give your insurance information. So, you may want to check to make sure that that was sent and received to your insurance company before you make any payments towards that bill.
Okay. Awesome stuff. Okay. And definitely check for in network versus out of network. Yeah.
100%. It is
Yes.
patient's responsibility. Or
Mm-hmm.
have your patient advocate help you,
Right.
if that's
Right.
something that's, just too exhausting for you to even worry about. That's what
Yeah.
patient advocates are here for.
right. Elective surgery or not, because I used to deal with a lot of, when I worked in the hospital, I used to deal with a lot of people who were going to be scheduled for bypass.
Mm,
So stressful situation through and through,
right,
and you just don't want to be caught off guard, right?
right, right.
So I like what you said about getting the NPI number.
Hmm.
You know, I never, because all physicians are healthcare providers, pharmacists, physicians, whoever, they have to have an NPI. So that's a
Right.
very great tip. And whenever you're calling um, the company for your insurance, or you're talking about that, get the reference number. And I also like to sometimes try to get the person's first and last name as well. I don't know if that'll
Yeah.
help, but because if you say you talk to Bob, well, they could have five Bobs. It's
Yeah.
like
Yeah, it's always good to document the date, the name of the person you spoke with, the reference number, the substance of your call, and then any action items and follow-up items. So,
right,
what's the next step and when am I supposed to follow up? And
right,
and keep it in one notebook. That way you're not fumbling back and forth. You can just
absolutely.
keep it in order.
Absolutely. Yes, yes. And so also pre-planning your call. This is
Yes.
huge to me because sometimes you can get on a call and you have a plan in your mind what you're going to do and what you're going to say and what you're going to ask, but then something else will happen during that call and then you're going down a rabbit hole, or you're
Mm-hmm.
going down someplace that you don't need to be going down, and you get confused and discombobulated. So I say, writing or typing or whatever it is that you're going to do, pre-plan any call.
Right, right. And
Right?
it's always good. If there, what is the saying that if you fail to prepare, then you're
You
preparing to fail,
fail.
right?
Yeah, that's it. That's it. Right, right.
So set
And
yourself up for success.
absolutely, absolutely. And then ask about prior authorization. Do you have to get authorization for a procedure prior to signing up for that procedure? Is that what you're saying? Can you
Yeah,
elaborate a
so
bit?
let's just say, you've met with your orthopedic surgeon. He says you need to have surgery to correct this broken bone. Okay. He gets you scheduled at, an in-network hospital. It's possible, especially with HMO plans, that an authorization is required. So it's really, it's proactive on the patient's part to call their insurance company and say, here's the procedure I'm having. Best bet to get the CPT code from your provider's office before making this phone call and say, I have the CPT code. Here is the diagnosis code that goes along with it. Am I covered? Number one, am I covered? And number two, does it require authorization? And three, is the authorization on file? If the authorization is on file, what's the authorization number? What dates is it approved for? And what physician and facility is the authorization approved for? If it's not on, if it does require an authorization and it's not on file, you would want to ask, what is required to get this authorization on file? So then they might say to you, your surgeon has to request an authorization. So then you can call your surgeon's office and say, look, I just talked to my insurance company. Here's the name and reference number of the person I spoke with. Requires authorization. They don't have a request on file. Can you please start that process? And I'll give you an example that I had with a client. Was in MD Anderson. She was getting cancer treatment.
Mm-hmm.
In the beginning of her care at MD Anderson, they asked for a PET scan. And she went ahead and had the PET scan, but because she had one within 30 days, they denied it.
Mm-hmm.
So about 6 months later, they wanted to do another PET scan. I got involved at this point. I called the insurance company. Yes, authorization's on file. No, we don't have a request. she was traveling out of state to MD Anderson. So it's not like she lived nearby, there was 5 days to get the authorization before her appointment. I called the department. Oh yeah, well, we're going to work on it. And I said, look, you already did one PET scan. It was denied. Don't do this again. Give yourself the opportunity for a denial if there is one. And guess what? The authorization was denied. They wanted a peer-to-peer review. And had I not called to follow up,
Right.
I wouldn't have known that. And I had to facilitate that between the hospital
Wow.
and the insurance company. They eventually ended up approving it, and she had her PET scan on time. But can you imagine what would have
The
happened if I had
stress,
not gotten
too.
involved? Yeah. Yeah.
Yeah, this is just amazing. My goodness. So that brings me back to my point of increased energy and stress and your time. It is well worth it to have a patient advocate on your side. I
100%.
can't think of any better reason to have a patient advocate that specializes in this, because all of us are not the same.
You got
And
it.
we even utilize each other for, help. And it's all about teamwork, right?
Exactly.
So
Exactly.
you have a wealth of knowledge, okay? So if
Thank you.
somebody wanted to learn more about, your services, what areas you service, or if they just had a question of how they could contact you, what is the best way? And you can use a number of different forms of contact for
Okay.
them to get in contact with you.
Okay. Well, I help patients all throughout Florida and nationally. So I can help all across the United States. If you would like to call me, my number is 561-665-7489. You can also email me directly at Denaro, that's DENARO BCPA, like board certified patient advocate, at gmail.com. And my website is I'm pointing the wrong way. Pondhawk. You can see how to Pondhawk advocacy.com. And from there, you can learn more about my services. And you can also schedule a free consultation if that makes sense to you as well.
Absolutely. Absolutely. Makes total sense to me. Well, Mary, thank you so much. This has been so much fun, very informative, and you just are a wealth of knowledge. I can't wait to have you back to talk about surprise billing. So we are going to do a part 2.
Yeah.
And I just thank you for being an advocate and doing what you do.
Thank you so much for having me and letting me talk about what I'm passionate about. The more people
Yes.
understand the situation or how to navigate this process, the better outcomes that they have. And I think that's why we're all in the patient advocacy industry, because, we just want patients to have the very best outcome clinically and financially. So I do appreciate what you do as well, because you also add value to the industry by guiding patients through their journey, and especially helping when family members are so far away. So thank you for what you do.
Oh, thank you. And thank you, everyone, for tuning in to Health Chats Among Friends, where we bring you reputable resources from our local communities. My name is Deidra Kindred. I'm a nurse advocate, educator, and navigator. I love bringing you reputable resources that you can use. Tune in next time for another amazing chat. Bye.